All right, we're talking all things Medicare and health insurance. Our experts are Catherine Sevier from AARP and Steve Edmonds from Alliance Insurance Services. Catherine, this person says, if I'm in the VA and I receive Social Security disability, what do I need to do? Do I need to still sign up for Medicare?
Yes, you need to check in with them as you turn 65 so that that transition is made seamlessly for you.
Okay. Steve, is it true that next year they are taking the donut hole away?
It is absolutely true, and it is probably the biggest sweeping change that has occurred in Medicare for many, many, many years. It's a good thing, a really good thing. But the coverage gap, or donut hole, as some people call it, is going to be completely eliminated. So you will only have two phases to your drug coverage in 2025. The first phase is your initial coverage phase. And in that phase, you simply make your co-payments for your medicine when you pick them up at the drugstore. The second phase will kick in at the limit once your medicine has added up to $2,000 for the calendar year. You will go directly into the catastrophic phase at that standpoint, and then most of your medicine will be covered without you paying any copay at all. So this is going to be a huge benefit, especially for folks that find that they're taking a lot of medications each month.
Okay, and so he mentioned this is going to be brand new for Medicare enrollment this year. And so, Catherine, let's talk about that, because every single year there is that enrollment period where you can change your coverage if you want to. And so you're saying this is going to be a big year for that.
It is. And every year, starting on October 15th, going to December 7th, you have an open season for Medicare, and you can choose to change your Medicare plan potentially from a traditional Medicare plan to a Medicare Advantage plan. You can also repurchase or look at your supplemental plans during that time and make a decision about which one works best for you. Do a good personal inventory of how you're using your plan and what drugs you're on, so that you can find a provider and the medications and supplies and equipment you need to best afford your care.
All right, Steve, this person says, if I'm still working and my employer doesn't offer insurance, can I get Part B and still work? I get my insurance right now through the marketplace.
Yeah, once you turn 65, you can sign up and get Medicare and continue to work, as long as you've got enough credit hours during your working years. Absolutely, you can get Part B. You can continue to work. You can get both A and B, as a matter of fact, and continue to work. And that's a really good setup a lot of times. So absolutely, you can do that.
So they should do Part A and B, and get rid of their marketplace insurance.
Yeah, absolutely. Okay. You're really required. It's a federal law when you turn 65. If you are eligible for Medicare, you must sign up for Medicare and drop the ACA policy.
Gotcha. Okay. Catherine, this person says they're retired. Their insurance is through the VA. Do I need Part B?
Yes, you do. And even if you're getting your care through the VA and Medicare work together to pay for your services. So there are things that Medicare covers that the VA may not, or vice versa, and they do matriculate together, so you have to sign up for both.
Okay. Steve, this person says, I worked for the state, but when I got my Medicare, it doesn't come with grocery benefits. Why is that?
So a lot of times you hear about these grocery benefits from other beneficiaries that are on Medicare. So the simple answer to that is that certain plans do cover grocery benefits. They cover utility payments, and they cover over-the-counter medications. But a lot of times those, or most every time, that is a D-SNP plan, D for dual eligible, meaning that you're eligible for both Medicare and Medicaid. And those are usually lower income recipients, and that's why they get those extra benefits. So your average Joe absolutely will not get those benefits.